Hello, my name is Harini.
And my name is Linda, and we'll be talking about hypertension today.
So let's talk about the pathophysiology of hypertension. It is known to be a common condition that affects the body's arteries. It is also referred as high blood pressure. The force of the blood pressing against the artery walls is constantly too high when having blood pressure. To pump blood, the heart needs to work harder. High blood pressure occurs in two forms, which are primary and secondary hypertension. Primary hypertension is idiopathic, which means that the cause is unknown. It usually develops gradually over time. Secondary hypertension is high blood pressure that causes by another medical condition. It appears out of nowhere and causes a greater blood pressure than primary hypertension. Secondary hypertension can cause by many different conditions and medication being taken. As you can see on this picture, on the left, it says no hypertension. So the heart is pumping normally and the blood is flowing easily through the vessels. On the right, hypertension, the heart is pumping harder, which means that the blood may not flow easily through the vessels. Now let's move on to etiology. The predisposed factor for primary hypertension is the person's age, ethnicity, and genetic factors, the person's sodium intake, as well as alcohol intake, obesity, and smoking. Secondary hypertension results from renal, such as nephrosclerosis, or endocrine, such as hypoldosteronism disease, a benign tumor of adrenal medulla or SNS chain of ganglia. In this type of hypertension, the underlying problem must be treated to reduce blood pressure. The normal blood pressure range is about 120 over 80 millimeter of mercury. There are two different types of stages in hypertension. Stage number 1 hypertension, the systolic pressure is around 140 to 159 millimeter of mercury. The diastolic pressure is around 90 to 99 millimeter of mercury. Stage 2 hypertension, systolic pressure is around 160 millimeter of mercury or higher. The diastolic pressure is about 100 millimeter of mercury or higher. So the at-risk population, it is estimated that 1/3 of the population in Canada has undiagnosed and uncontrolled diseases. There is a higher risk of high blood pressure in men until they turn 55 than women. It has been found that African Americans have a higher rate of hypertension. It is due to atherosclerosis or plaque formation in the arteries that raises the risk of high blood pressure.
Okay, let's now talk about the clinical manifestation of hypertension. Usually, early stages of hypertension is asymptomatic, so there aren't any symptoms, and that is why it's referred to as the silent killer. So, as their hypertension progresses and target organ disease has appeared, the person may experience fatigue, dizziness, fainting, headache, facial flushing, epistaxis, meaning nosebleed, visual changes, and shortness of breath. Alright, now let's move on to diagnosis tests. As blood pressure has often no obvious symptoms, the way for healthcare professionals to diagnose it is often checking the blood pressure over time with a blood pressure device and asking for your symptoms and medical history. So after checking on your blood pressure for a period of a few weeks or a few days, the doctor may then diagnose you with high blood pressure. And if you are diagnosed with high blood pressure, the doctor may conduct tests on you to check for the underlying cause. The doctor will request for a lab test to be done to check your cholesterol and blood sugar levels, and also to check your kidney, liver, and thyroid function. A ECG will also be done to test your heart and electrical activity, and a echocardiogram will also be performed to show how your blood moves through your heart and heart valve. High blood pressure can quietly damage the body for years before symptoms develop. If your hypertension is left untreated, it can have major effects on your kidneys, causing renal failure and nephrocalcinosis, which is a condition that causes your kidney to harden because of the high blood pressure. Hypertension can also affect the heart and cause congenital heart failure, atherosclerosis in the heart, angina, and myocardial infarction. You can also have conditions that affect the brain and the eye, like CVA, peripheral vascular disease, which is a condition that causes blood vessels outside the heart and the brain to narrow, block, or spasm. And high blood pressure can also damage the retina by damaging the tiny delicate blood vessels that supply blood to the eyes, causing all types of conditions. High blood pressure, changing your diet is very important and having food with less salt. A person needs to also get moving, so getting regular physical activity can also help with your high blood pressure. As we all know, the perpetrator of all our health issues is usually alcohol and smoking. So limiting alcohol is very, of course, it's easier said than done, but getting 7 hours to 9 hours of sleep daily can really help control somebody's hypertension. Sometimes life changes aren't enough to treat high blood pressure. So the doctor may recommend medicine to lower your blood pressure like diuretic, ACE inhibitors, or angiotensin receptor blockers. Alright, now let's now put our knowledge to the test and see if we remember some of the information that we just learned. So we are going to ask you a couple questions and yeah, hopefully everybody gets the right answer. Here we go.
With question number 1. If you have high blood pressure, you should avoid exercising. The answer is false, because regular exercises not only decreases the blood pressure but also strengthens the heart. So it reduces stress and helps people maintain a healthy weight. By talking to a doctor about the type and amount of exercise that the person should undertake is very important.
Alright, now let's move on to question 2. Alright, this should be an easy one for everybody. What test would you conduct every day if you had hypertension? 1. A ECG. 2. A blood pressure device. 3. A echocardiogram. And the answer is number 2, a blood pressure device. As we know, blood pressure reading are essential for diagnosing and treating high blood pressure. So our primary goal is to always know the person's number in order to keep tabs on if their blood pressure is worsening.
Question number 3. What is the most common cause of hypertension? Number 1, feeling tired constantly. Number 2, heart beating fast. Number 3, no symptoms are present. The answer is number 3, no symptoms are present. The reason behind this is because high blood pressure is known as the silent killer since it generally has no evident symptoms.
Let's now go over what we've learned. We've learned that hypertension is a common condition that affects the body's arteries. There are two kinds of hypertension: primary hypertension and secondary hypertension. Primary hypertension, the cause is unknown. Secondary hypertension is caused by another medical condition. Men are more affected by hypertension. Genetics can also play a factor in increasing one's chances of having it. Hypertension is asymptomatic, meaning any, there isn't any symptom, so that is why it's known as the silent killer. As organ disease occur, a person may experience symptoms. Some tests used to detect high blood pressure and hypertension is a blood pressure device and an ECG and much more. The way to treat hypertension can sometimes be as simple as a lifestyle change, or sometimes, if it's not like that, it, the doctor might prescribe medication.